Hello, my name is Alexandra with Theta Spring Hypnotherapy out of New York City. Today we're going to talk about the difference between conventional therapy and hypnotherapy. There is a time and a place for each. They are both wonderful modalities that actually can work in adjunct to each other. A lot of clients have come to me saying, Alexandra, I've been in therapy for years. I truly understand what's going on, but I'm not going to behavioral shift in where I'd like to feel more satisfied in my life. And I applaud everybody for doing everything they can in their lives. Sometimes finding help can be the hardest step. The difference of where hypnotherapy and therapy are is that therapy is going to help you begin to understand the patterns of your life, delving into your past, looking at who were you then, and really bringing you up to date into who you are now. Therapy is a wonderful, powerful tool, and it is something that you can be in if you find the right therapist for a little bit of time. And that can sometimes be the limiting factor for a lot of people from what I've learned from talking with them. Hypnotherapy, while we sometimes will do a little bit of work in the past through regression work or even beginning to just ask questions as to where some of the associations of the subconscious mind might be made, we really focus on the now. Where are you now? Who are you now? Who are you as you begin to move through the stress of life? And where is it that you'd like to be? We begin to focus on now and moving you into your future, thereby letting go of the past. When working with a hypnotherapist, it's important to know that this is a wonderful adjunct tool to your life. It's here to be the subconscious support and partnership with you. However, there are many limitations to it. While we are trained extensively in hypnosis and what to do in the hypnotic state, how to utilize the hypnotic state to the most expansive capabilities, we are not therapists the way that a psychiatrist or psychologist or social worker are. There are times when we might feel that it is important for you to go talk to a therapist because it's outside the scope of where we work. The same way if you had trouble with your diet, we might send you to a dietitian. With Theta Spring Hypnosis, it is always my job to make sure that you are taken care of and taken care of in the best way possible. Just because we recommend something to you does not mean that you have to do it. It is a request, it is a suggestion, it's something for you to think about. You are important to us, and so are your goals, and if we can't be the one to help you get there, we are certainly going to help you, refer you to the right people. I hope that's been really helpful in helping you understand the difference. Another difference is that psychotherapy and therapy is going to help you really understand your subconscious mind, the behavioral responses. It's going to help you bring it up to a conscious level to understand it, because your conscious is where your logic, your reason, willpower, and deductive reasoning is. What hypnotherapy is going to help you do is to take all of that information that you're not consciously aware of and bring it back down into the subconscious, creating new associations for behavioral responses. It is not always going to work. There is no guarantee. Just because a hypnotherapist can get you into the deepest state doesn't mean that the hypnotic suggestions are going to be taken in. Unfortunately, we can't erase your mind. We can't make you do anything you wouldn't want to. We are not magicians, although if we were, I promise you'd be our first person we'd help. And so hypnotherapy does work as a wonderful adjunct tool to many, many disciplines and many, many practices. If you have any more questions, we certainly would love to hear from you in the comment section on this video. And my name is Alexandra with Theta Spring Hypnosis out of New York City. Have a beautiful day.